Good morning, everyone, and welcome to today's webinar on ISO 13485-2016. My name is Shannon Craddock, and I'm the Programs and Accreditations Manager at PJR. We're glad that you could participate today. All participants have been muted to ensure sound quality. If you have any questions, please type them into the question feature of the GoToWebinar, and I will answer as many of those as possible at the end of today's prepared presentation. So today we'll be talking about the transition requirements, when you have to be ready, how the audit will take place, etc. We'll then go through a summary of the changed, new, and any deleted requirements, comparing 13485-2003 to 13485-2016, and then answer any questions that you have. Again, to ensure sound quality, type all questions into the question feature of GoToWebinar. A copy of the slides and a recording of today's presentation will be available for download from our website, www.pjr.com, within 24 to 48 hours from the conclusion of today's presentation. So let's start by talking about the transition requirements. The ANAB, the accreditation body based in the United States, which is PJR's accreditation body for the 13485 program, published one of their heads-up documents, specifically number 340, relating to the transition process for certification bodies as well as clients that are certified. The standard itself was published on the 1st of March 2016, and an International Accreditation Forum, or IAF Resolution 2015-13, details a transition period of 3 years from the date of publication. And this 3-year transition is very similar to the transition period given for 9001-2008 to 2015 and 14001-2004 to the 2015 version of the standard. Now, what CBs were required to do is apply to their accreditation body for transition, and once they were approved, they're able to issue certificates to 13485-2016. PJR has already completed this process, and we're able to audit and issue certificates to 13485-2016. Given that we have a full 3 years for the transition, we are encouraging clients to try to transition on their recertification audit. And this is because if you transition on the longer recertification audit, where all requirements of the standard get audited anyway, it's recertification after all, we're not adding any additional audit time for those clients that are strategically planning to make sure that their own internal transition coincides with their recertification audit. If for whatever reason you need to transfer on your surveillance audit, then we will be adding a half day to the on-site time to cover the requirements. This is because the surveillance audits are typically shorter in duration than the recertification audit, a third shorter in fact. And we need to make sure that we have sufficient time to cover all the new requirements. Now, given that the standard was published the 1st of March 2016, the transition period will end the 28th of February 2019. So to ensure that all clients transition on time, they have sufficient time to answer any nonconformities, and PJR's decision-making body can make a certification decision to 13485-2016, as well as issue the certificate, we're going to ask that you transition by the 1st of December 2018. That means if you have a January or February transition date, the latest possible time you want to do this would be January, February 2018. You cannot wait till January, February 2019 without risk that there may be a lapse in your certificate. Okay, so let's get into the requirements themselves. And before we get into the normative requirements, let's take a look at section 0.1 general. Here we see more detail regarding the types of organizations covered by 1345-2016 and the life cycle stages in the life cycle of a medical device that can be covered. So regarding the life cycle stages, organizations involved in early stages like design and development, as well as production, are included. And then post-production stages such as storage and distribution, installation, servicing, final decommissioning, and disposal of medical devices, as well as design, development, and provision of associated activities. Types of organization can be suppliers or external parties providing product, such as raw materials, components, subassemblies, sterilization services, calibration, distribution, maintenance services, to any of these types of organizations. 0.1 also states that 1345-2016 requires the organization to identify its role under applicable regulatory requirements. Then identify the regulatory requirements that are applicable to your activities under these defined roles. And finally, implement and maintain these regulatory requirements by incorporating them within your medical device quality management system. Section 0.2, clarification of concepts. You'll see the use of the term as appropriate several times throughout the normative requirements of the standard. As appropriate should be deemed to be appropriate unless an organization can justify otherwise. And a requirement is always considered to be appropriate if it's necessary for you to comply with applicable regulatory requirements or to help you manage risks. And they further clarify the meaning of risk. It pertains to safety or performance requirements of the medical device or meeting applicable regulatory requirements. So many times throughout the standard, you're asked to define and identify risks. You need to be considering those related to not only the safety or performance of the medical device, but those related to whether or not you can achieve meeting the applicable regulatory requirements. 0.3, we see the emphasis on the process approach. This really shouldn't be anything new. Here we've got an explicit statement that drives the process approach to quality management. You need to understand and meet the requirements first of all. Consider processes in terms of added value. So what are the processes you need in your organization to transform inputs into valuable outputs? And then once you've determined what these processes are, you need to collect information on them, measure them, to make sure that they're effective and they're doing what you need them to do. Are they meeting the objectives and targets that you've set? And if you find you're falling short, improve the processes based on this objective measurement. Or if you're continually meeting your objectives, can you elevate those targets to drive this improvement? All inherent in the process approach to quality management. Okay, still not in the normative requirements, section 1, scope. Again, we see a reiteration of the expanded applicability of the standard in terms of life cycle stages and inclusion of suppliers and external parties to the medical device manufacturer. There's a clarification that outsourced processes are the responsibility of the organization and need to be accounted for in the medical device management system by monitoring, maintaining, and controlling the process. So you may outsource manufacturing of your medical device, either the whole device or components or sub-assemblies. You're still responsible for it. And this needs to be monitored, maintained, controlled. And there's also a clarification that requirements in section 6 and 8, as well as section 7, can be justified as non-applicable as long as they don't impact your ability to meet a regulatory requirement or impact the safe functioning of the device. So there are some new terms and definitions in section 3. And if you look at the 13485-2016 standard, you'll see that there are many, many new terms. In fact, we could do a 1-hour webinar just on the new terms that have been added. For the purposes of today's general overview presentation, I've selected a few of those that I think are most important. First is the authorized representative, and this is the natural or legal person established within a country or jurisdiction who has received a written mandate from the manufacturer to act on his or her behalf for specified tasks with regard to the latter's obligation under that country or jurisdiction's legislation. Okay, 3.4, and the reason I selected complaint is because the definition of a complaint here differs from the 9001-2015 definition. And many of our medical device customers also have a certification in 9001-2015. So I wanted to call out this very specific definition of a complaint. It's a written, electronic, or oral communication that alleges deficiencies related to the identity, quality, durability, reliability, usability, safety, or performance of the medical device that has been released from the organization's control or any related service, perhaps the sterilization service, that affects the performance of the medical device. 3.5 is the distributor, a natural or legal person in the supply chain who, on his own behalf, furthers the availability of the medical device to the end user. There may be more than one distributor in the supply chain, and people involved in activities such as transport or storage on behalf of the manufacturer, importer, or distributor are not distributors under this particular definition. An importer is the natural or legal person in the supply chain who is the first in the supply chain to make the medical device manufactured in another country or jurisdiction available in the country or jurisdiction where it is to be marketed. And finally, 310 is the natural or legal person with responsibility for design and or manufacture of a medical device with the intention of making the medical device available for use under his or her own name, whether or not such medical device is designed and or manufactured by that person himself or on his behalf by other persons. And I encourage you to look at this definition in more detail. There's many subpoints that I did not include in today's presentation. For those of you that have used 1345-2003 or the 2012 European version, you would note that italicized font called out ISO 1345 or medical device specific requirements. This is no longer the case in ISO 1345-2016. Okay, so let's get into the requirements now. 4.1. The organization shall document the role undertaken by the organization under the applicable regulatory requirements. Are they a manufacturer, the authorized representative, importer, or distributor? Okay, 4.1, 4.1.2a and 4.1.2b, these hit on the process approach, which we talked about in section 0.2. The organization has to determine the processes needed for the quality management system and the application of these processes throughout the organization, taking into account the roles undertaken by the organization. And then apply a risk-based approach to the control of the appropriate processes needed for the quality management system. (4.1.4) A through C, changes to QMS processes shall be evaluated for their impact on the quality management system, as well as their impact on medical devices, and controlled in accordance with 1345 and regulatory requirements. So if you're changing a process, you have to impact You have to assess the impact of that change on not only your management system, but the device itself and your ability to comply with any applicable regulatory requirements. 415 talks about outsourcing. So when an organization makes a decision to outsource a process that affects product conformity, they need to monitor and control the process. They're responsible for conforming to 1345/2016 and any customer requirements, as well as any applicable statutory regulatory requirements. And the amount of control they have over this outsourced process needs to be proportionate to the risk involved and the ability of the external party to meet the requirements. So if you're outsourcing manufacturing to a sub who is also 1345 certified, perhaps your level of control would be minimized because the risk is minimized due to them maintaining this certification. Perhaps that level of control would be increased and the monitoring would be increased if that supplier was only 9001/2015 certified. And it would be increased even more if they're not certified at all. And any controls that you intend to have to maintain the integrity of this relationship and ensure conformity to 1345 customer and regulatory requirements need to be included in written quality agreements, your terms and conditions, your operating agreement, your memorandum of understanding, whatever form it takes, with the entities to whom you outsource a process that affects product conformity. 416 says that you need to document procedures for validating computer software used in your quality management system. So this may not apply if you don't use computer software. It needs to be validated prior to use and in response to any changes. And the extent of this revalidation and initial validation needs to be proportionate to the risk associated with the use of the software. And you have to maintain records of these validation and revalidation activities. So some examples to demonstrate differences in approach to the validation and revalidation process. If your computer software is an integral part of your medical device, the validation protocol, both initial and revalidation, would be very stringent. If you're using computer software, for example, for tracking calibration of the gauges used in your manufacturing processes, or using validation software, if you're using software for your maintenance program, the initial and revalidation protocol may not be as stringent. Okay, 423 talks about the medical device file. And for each medical device, or in some cases, medical device family, you need to establish and maintain a file containing or referencing the location of documents required by 1345 and any applicable regulatory requirements. The file likely will contain a general description of the device, its intended use or purpose, labeling requirements and any instructions for use, specs for the product, specs or procedures for manufacturing, packaging, storage, handling, and distribution, procedures for measuring and monitoring, requirements for installation and servicing as appropriate. Okay, 424 talks about control of documents. There's a requirement for a procedure, and the procedure needs to address preventing deterioration or loss of documents. So this is the additional requirement. Of course, there was always a procedure for document control. Control of records. The organization is required to define and implement methods for protecting confidential health information that might be contained in records in accordance with regulatory requirements. So as part of your medical device manufacturing process, you may get your hands on confidential health information. You need to protect this information, and that needs to be defined in a procedure. Okay, 5.6 management review. You need to have a documented procedure for management review. You need to review the QMS at documented plan intervals. New inputs to the management review process include feedback. Previously, this was just customer feedback. So we need feedback from multiple sources. It may be employees, it may be suppliers, it may be regulatory agencies, etc. Complaint handling and reporting to regulatory authorities are other new agenda items or inputs. 6.2, human resources. The organization has to document a process, can be a procedure, a flow chart, however you want to do it, for establishing competence, providing needed training, and ensuring the awareness of personnel. It could be a software program that you're using for training, but some sort of documented process. And this, as a side note, is a very common shortcoming. Oftentimes we'll see training records for employees, but many times what's lacking is a default of the defined competency requirements for a particular position, so we can ensure that the training provided is in fact sufficient. Okay, 6.3, infrastructure. The organization has to document the requirements for the infrastructure that's needed to prevent product mix-up and ensure the orderly handling of product. Infrastructure is to include any information systems used, and maintenance has been clarified to be applicable to equipment used in production, controlling the work environment, and monitoring and measurement. So ensuring that you've established the environment needed to ensure conformity of product to specified requirements. Is a clean room necessary? What is your product flow to ensure that no product gets mixed up with non-conforming product, etc.? (6.4.1) work environment. You need to document the requirements for the work environment needed to achieve conformity to product requirements. Is a clean room necessary? Certain temperature, humidity, certain training, electrostatic discharge issues. 6.4.2, contamination control. If you're making a sterile medical device, you need to document requirements for controlling contamination with microorganisms or particulate matter and maintaining required cleanliness throughout assembly and packaging. 7.1b, planning product realization. The organization needs to provide resources specific to the product, including infrastructure and work environment. So early in the planning stages, you need to make sure that you have sufficient resources to meet the requirements needed for the manufacture of the product. And you need to ensure you can meet required handling, storage, distribution, and traceability activities. What's required? Certain traceability, certain storage or distribution requirements. All of these need to be planned for. 7.2.1, you need to determine any user training needed to ensure the specified performance and safe use of the medical device. And review of requirements related to the product. This review must occur prior to the organization's commitment to supply product to the customer. Ensure that applicable regulatory requirements are met and any user training previously identified is or will be available. Okay, let's get into design and development. You'll note here that design and development is still in section 7.3. Unlike 9001-2015, when 13485 was revamped, it does not follow the Annex SL arrangement. So you should be familiar with most of this numbering. (732) Design and development planning. During design and development, the organization has to document what reviews are needed at each design and development stage. So what's your roadmap? What reviews have to take place at what stages, what gates? The method to ensure traceability of design and development outputs to design and development inputs, and what resources are needed, including any specific competency requirements for personnel involved in the process. Here we see a deletion of a requirement that related to the management of interfaces. 733, design and development inputs. Inputs relating to product requirements must be determined and records maintained. And inputs shall include usability requirements. And any requirements shall be able to be verified or validated. (735) Design and development review. Now remember, in your planning stage, you've determined when reviews need to take place. Your records to prove design reviews have taken place have to include the identification of the design under review, who was involved, and the date it took place. 736, design and development verification. The organization is required to document verification plans that include the methods that are going to be used, acceptance criteria, and as appropriate, if any statistical techniques are used, with the rationale for the sampling size. Now, in your verification activities, if the intended use of the device requires a connection or interface with another part of the device, then the verification shall include confirmation that the outputs meet the input requirements when in fact the device is connected or interfaced with that other component. And records of the results of verification activities and any conclusions drawn have to be maintained. (737) Design and development validation. You have to document the validation plans, including your methods, acceptance criteria, and as appropriate, techniques used with rationale for sampling, for sample size. You need to record your rationale for why you chose a specific product for validation. And similar to verification, if the intended use of the device requires connection or interface with another, validation has to take place that way. And records of the results of validation activities, including any conclusions drawn, necessary actions to be taken, have to be maintained. Okay, 738 is a completely brand new requirement relating to design and development transfer. The organization has to document procedures for transfer of design and development outputs to manufacturing. The procedure has to ensure that outputs are verified as suitable for manufacturing before becoming final production specs, and that production capability can meet product requirements. Any results or conclusions of transfer verification activities need to be recorded. (739) Control of design and development changes. So whenever the design changes, the organization has to determine the significance of the change as it relates to the function, performance, usability, safety, and applicable regulatory requirements for the medical device and its intended use. The review of the design and development changes need to include evaluation of the effect of the changes on parts, WIP, delivered product, inputs, outputs to risk management, and the product realization processes. So both processes and product. Okay, new requirement 7310, design and development files. If the organization is design responsible, they have to maintain a design development file for each medical device or family. The file must include or reference records generated to demonstrate conformity to the requirements for design and development. So your design review records, your planning, your verification and validation, and any necessary actions resulting from those activities. And they need to include or reference records for design and development changes. (741) purchasing process. There's new criteria relating to evaluation and selection of suppliers. You need to consider the performance of the supplier, and the criteria used for evaluating and selecting them needs to be proportionate to the risk associated with the medical device. Obviously, if they're providing an integral component part or maybe a sterilization service, there's a lot of risk there. Your level of control and the type of criteria used should be reflective of that. The organization needs to plan the monitoring and reevaluation of the supplier, including their ability to meet requirements for purchased product. Results of this ongoing monitoring shall be an input to the supplier reevaluation process. If there is ever a non-fulfillment of a purchasing requirement, it needs to be handled based on the risk associated with the purchased product in compliance with applicable regulatory requirements. And records relating to selection, ongoing monitoring, and reevaluation of suppliers needs to be maintained. Purchasing information must include, as applicable, a written agreement that the supplier notify the organization of any changes in the purchased product prior to implementation of any changes that affect the ability of the purchased product to meet specified requirements. Cleanliness of product. The organization shall document requirements for cleanliness of product or contamination of control of product if the product cannot be cleaned prior to sterilization or its use, and its cleanliness is of significance in its use. So this is a requirement that may not necessarily apply to every medical device manufacturer. Servicing 754. The organization needs to analyze the records of its servicing activities carried out by the organization or its suppliers to determine if the servicing activity should be classified as a complaint and as an input to the improvement process. So this should definitely be something that you discuss in management review as feedback. Remember that feedback category is more generic. 756, validation of processes for production and service provision. You have to have a documented procedure for validation of processes. And this documented procedure needs to include revalidation criteria for revalidation and approval of changes to processes. The requirement for a documented procedure for validation of computer software remains. And again, the specific approach used must be proportionate to the associated risk and the effect of the ability of the product to conform to specifications. And any results, conclusions, or necessary actions resulting from these validation activities need to be maintained as records. We introduced the concept of a sterile barrier system. And also we touch on processes for sterilization. These processes need to be validated prior to implementation and following any product process changes. Records of the results, conclusions, and any necessary actions from these validations need to be maintained. And there's a call out to ISO 11607-1 and -2. (758) Identification. If it's required by regulatory requirements, the organization shall document what their system is to assign a unique device identification to the medical device. And the organization has to have documented procedures to ensure that medical devices returned to the organization are identified and distinguished from conforming product. Again, this might relate to your infrastructure requirements. How are you going to ensure that this product is separated and not mixed up or confused? 7511, preservation of product. The organization must protect the product from alteration, contamination, damage during processing and storage, handling, and distribution by designing and constructing suitable packaging and shipping containers. Documenting any additional requirements for special conditions needed if the packaging alone isn't sufficient. And if special conditions are required, they have to be controlled and recorded. Moving into Section 8, there has to be a documented procedure for a feedback process, including production and post-production activities. The feedback gathered needs to be an input into risk management for monitoring and maintaining product requirements, as well as the product realization or improvement processes. 822, a new section on complaint handling. 822 is previously internal audits. Organization needs to have a documented procedure on complaint handling that addresses timely handling in accordance with applicable regulatory requirements. If the decision is made not to investigate a complaint, justification or the rationale for not doing so needs to be documented. If an organization's investigation and its problem solving reveals that activities outside of the organization contributed to the complaint, relevant information needs to be flowed down between the parties, and records shall be maintained of all of these activities. 823, reporting to regulatory authorities. This is a new requirement that if applicable regulatory requirements requiring notification of complaints that meet specified reporting criteria of adverse events or issuance of advisory notices, the organization shall document what their procedure is for providing notification to the appropriate regulatory authorities. So you may never use these procedures, but you have to have them at the ready. What is our process for reporting an adverse event or issuing an advisory notice? Records of reporting to regulatory authorities need to be maintained. 826, monitoring and measurement of product. Records needed to identify test equipment used to perform measurement activities. So your records of any monitoring and measuring done need to identify which test equipment was used. You can record a serial number or an internal gauge ID. (8.3) Control of non-conforming product. Nothing new here. You need to have a documented procedure, but it needs to define the responsibilities and authority for identification, documentation, segregation, evaluation, and disposition of non-conforming product. The evaluation needs to include a determination of the need for an investigation and notification of any external party responsible for the nonconformity, and records of your evaluation, investigation, and rationale for any decisions have to be maintained. In 832 versus 833, we see a separation relating to actions in response to non-conforming product detected before delivery versus actions taken in response to non-conforming product detected after delivery. And if non-conforming product is accepted by concession, it needs to be only in cases where justification is provided, approval is obtained, and applicable regulatory requirements continue to be met. And for products, actions taken in response to non-conforming product detected after delivery, the organization has to document procedures for issuing advisory notices in accordance with applicable regulatory requirements. Procedures shall be capable of being implemented at any time and records maintained. 8.4, analysis of data. The required procedure shall now include a determination of appropriate methods, including statistical techniques and the extent of their use. And the analysis of data needs to include input from audits and service reports as applicable. 8.5.2, corrective action, and 8.5.3, preventive action. Again, still requirements for procedures, and these procedures need to include a verification that the corrective preventive action does not adversely affect the ability to meet applicable regulatory requirements or the safety performance of the device. That concludes the prepared portion of today's presentation. I will now open the floor to any questions that you may have. And again, as all participants have been muted to ensure sound quality, type any questions you have into the question feature, and I'll do my best to answer as many of these as possible. Okay, risk defined differently in ISO 13485-2016 and ISO 9001-2016. Fred, to be clear, ISO 9000-2015, not 9001, ISO 9000-2015 will contain the definition of risk, and the definitions are different. Someone's requesting clarification in some of the definitions. Natural person versus legal person. A natural person could be a human. A legal person could be a legal entity. And again, a copy of today's slides, as well as a recording of today's webinar, will be available within 24 to 48 hours from the conclusion of today's presentation. www.pgr.com is where you can download it. It's also here where you can access information on upcoming webinars. I'm gonna wait to see if any additional questions come in. Okay, question, is risk in ISO 1345 only within regard to the medical device itself, or is it also operational? So I believe we had a slide on this, so let's go back. See if I can quickly identify where this was. Okay, use of the word risk pertains to the safety or performance requirements of the medical device. So there, Fred, you see risk relating to the medical device itself and its safety and performance. Is it meeting its intended purpose or meeting applicable regulatory requirements? So that or meeting applicable regulatory requirements tells you that it could relate to other parts of the process. So in your words, it's also operational. See if we get any other questions. We'll wait just a few more minutes, see if any other questions come in. Okay, Matt, I'm not sure I understand your question about outsourced process. Does this mean supplier controls are, I think you're trying to say, not adequate? So if you outsource a process, it depends on what process you're outsourcing. If you outsource sterilization or sanitization, or you outsource the manufacture of component, the control you have over that supplier needs to be significant, as opposed to maybe outsourcing maintenance or calibration of a piece of equipment. The control you have over that supplier might be less. It depends. Okay, folks, it appears that we are out of questions. I haven't had any come in for some time. I hope you enjoyed today's webinar, and good luck on your transition to 1345-2016. We've got a question coming in from Nagesh, and I will answer this. Do we need a procedure for software validation for a computer control system? Yes, you would need a procedure for software validation. There's a procedural or documented process requirement for that, Nagesh. Okay, folks, I appreciate your time today. Thank you, and I wish you the best of luck in your transition.